Steve Rattner is looking at how difficult it's going to be to get some who feel they need to undo the damage of Obamacare. Let's talk about that.
It's a tough problem. So let's start by taking a look at what Obamacare actually is. So 26 million people have gotten coverage under Obamacare. And if you look at this chart, you'll see that about half of them have gotten it through the Medicaid expansion, which you guys were just referring to, and we can talk about some more. And most of the rest have gotten it through subsidies for people who are not at the very bottom of the income scale, but are in the 100 to 400% of the poverty line scale. And as many as 10 million people could end up losing coverage, and I'm going to show you why. First, if you take a look at what's going on in the subsidy market on the next chart, you will see. There we go. You will see that the Trump administration is proposing tax credits of $2,000 to $4,000 for people, and they would go all the way up to people who make more than $75,000 a year. Those tax credits wouldn't vary by how much your health care cost or where you lived or by your income. So somebody who made $75,000 would get the same tax credit as someone who made $20,000. And they are a small fraction, in some cases, of what the subsidies and tax credits have been under Obamacare. So if you were getting $9,000 a year from Obamacare to pay for your health care, you'll now be getting $4,000 a year to pay for your health care. And this will drive anywhere from 2 to 4 million people off of health care, according to estimates that have been done by the by Standard & Poor's.
But you go back to the last chart. You have higher income, $75,000.
Yeah, I was just going to go back to the last chart for one.
If you live in the tri-state area and you make $75,000 and you have 3 children, lots of luck. Lots of luck with your health care.
Those would be known as losers under the new plan.
Those would be known as people that will not be able to afford health care.
Well, right now, in fairness, right now, for an individual, families get a different deal, but for an individual, they don't get subsidies under Obamacare. They will get tax credits under this new plan.
Okay.
So if you go to the Medicaid expansion, so this blue line here that goes up to $142 billion is what would have to be spent in order to fulfill the commitment to provide Medicaid expansion to people making $20,000 to $40,000 a year, roughly. The Trump administration proposes to reduce that and then cap it at $90 billion, and that could cost as many as 4 to 6 million Americans their health care, because the states are simply going to cut back on their Medicaid programs if they don't get this money. And by the way, they're also cutting money out of regular Medicaid as well, which will reduce what's available for Medicaid to the states. So what's ironic about this plan is that it is extremely harsh with respect to what happens to the existing Obamacare, but given the attitudes in the House and in some parts of the Senate, not harsh enough in terms of what they would like to see in a full repeal. And then on the other side, you have the more moderate Republicans like Rob Portman and Shelley Moore Capito and people like that in states where Medicaid was expanded, who say this is too tough. And so they're caught right in the middle of it all.